Rachel, welcome. Hi.
It's great to speak with you.
You too. Welcome to Startup Help TV.
Thank you for having me.
I know that this started from a personal reason, as I'm so interested from a personal reason. Please tell us about how you got this Ouchie app.
Sure. So at Upside Health, we're dedicated to really scaling and eliminating the devastation of chronic pain from an economic and emotional perspective. And personally, I was in my early 20s when I was diagnosed with a painful connective tissue disease. But I found myself at an unfortunate, albeit kind of weird advantage in that my mom has lupus and my brother has cystic fibrosis. So I grew up in a family that lived with chronic pain, and I was able to quickly realize how you can live with a chronic pain condition and not be controlled by it, but also what are the best resources to help the whole health system be able to provide that great care that I was able to get.
It's interesting because your family normal was dealing with chronic pain. And for families where it just comes out of nowhere, they're blindsided and they have no resources. So the fact that you've decided to take your personal family journey and transform the experience for other people is magnificent.
Thank you. I mean, I think that, and it's obviously chronic pain is such a personal experience. There's no real one-size-fits-all to effective treatment and effective management, but it's also about resetting expectations. As much as that sounds terrifying, it's not. It's just learning, if my pain were 50% less, what would I do differently?
But having chronic pain is so lonely because it's not like wearing a cast. People think
invisible.
You're faking. It's invisible. So talk to me about what this app will do to help people living with chronic pain.
Yeah, so a lot of what we're doing these days is actually helping healthcare providers help the chronic pain patients, because they're stuck. They're like, their hands are tied in terms of what they can do during a 20-minute visit or less, a 10-minute visit to effectively help it. And a lot of what the chronic pain patient suffers with is not just the pain itself, but the isolation and frustration that it causes. And so what we've done with our Ouchie app is give patients a place that they can find the resources that help them when they need it most. So responding to their particular needs at their particular time. And one of those key components is access to others. People who are going through similar challenges have found successes, and using each other for a support system in a place that's not just your family, where you don't feel alone, and where you can be seen for both your successes and your challenges. Because that's really important. You're going to have bad days, but also working together to find more good days.
What's interesting is that it's not just a digital diary. It takes it to a whole nother level. It helps you build a community. And I remember when my daughter was early in her experience with chronic pain, it was so lonely. It was so incredibly lonely. So to be able to talk to other people who have this invisible drama is so helpful.
Yeah, and to do it in a structured way, right? I think that sometimes forums or social communities can serve a purpose, but it can be limited in scope because there's no goal. So what is kind of missing from that? And so it's hard for health systems, payers, insurance companies to recommend something like that, because there needs to be that goal. And so to be able to create this environment where patients are all working together towards their personal goal, and to feel like there's someone always on their team 24 hours a day that is there to support them, is incredibly important.
So what data are you gathering?
Yeah, I mean, we're gathering a lot of data about the qualitative and quantitative impact of pain. So how it's impacting mood, sleep. We've gotten really interesting insights about the correlation between chronic pain patients and cats, or art, and the impact that various art therapies have had on the patients. But then also how pain score is impacted by introducing integrative wellness techniques into the pain experience, and how that's impacting provider workflow and their ability to deliver quality care that they want to deliver.
This is so helpful because it helps the patient articulate in so many ways what they're going through and gives the provider an ability to help them in a much more reliable way. Because if you're having a good day or a bad day and you're at a doctor, you might not remember the other 5 bad days because you block it out. And now the healthcare providers can really see what's going on. And I think it would make treating so much more effective.
Right. It's less like, shooting dartboards against the wall and seeing with sticks. It's being able to get real-time analysis as to what's working for this particular patient and be able to create customized treatment solutions, but also be able to say, look, when you've done these sleep stories, like, yes, you might not have thought your pain level was going down, but you've had a better sleep, your mood's improved, and let's do this together.
Incredible.
And so we're really excited about what's ahead and what we've created.
I'm so happy for you. I'm so happy that you're making this difference in the world, and I can't wait to recommend it to as many people as possible.
We can't wait to help support them on their journey.
Thank you so much, Rachel.